Hi, it's Christina with the Sisyphean Journal. Today's September 27th, and we're looking at one of many women to die at the infamous Inglewood Women's Hospital in Los Angeles. And we're also going to look at an illegal abortion death that, but for the legal status of the abortion, pro-choicers just wouldn't care about because all surgery has risks, right? So if we look at 22-year-old Lynette, she went to Inglewood Women's Hospital in Los Angeles on September 13th, 1975, and she had her safe legal abortion. And Inglewood was a hellhole. This is a place where while the inspectors were on site, they were in the recovery room. The women are all laying on their cots, and the doctor came in to do the discharge exam to make sure these women were recovered enough that it was safe for them to leave. And a staff person just come up with the patient's chart, would point at which patient it was, he'd nod, he'd sign off in front of the inspector. This is the kind of diligence that they were practicing. So they weren't exactly having the doctor make sure that it was safe for these women to leave now, were they? So Lynette had her abortion on September 13th, 1975. Now, early on the morning of September 27th, she went to the emergency room reporting abdominal pain. And staff reported that she became agitated and difficult to handle, and they put her in restraints. What in the world were they thinking? And she was pronounced dead at 10:53 a.m. Now, the autopsy revealed what the abortionist should have detected and what the emergency room probably should have thought about, which was that the fetus had not been in her uterus. It had been in her fallopian tube, and her tube had ruptured. Now, in theory, women who decide that they're going to have an abortion should be less likely to die of a ruptured ectopic pregnancy because, first of all, now this was back before routine ultrasound, but ultrasound was a thing. So they did have access to that. You do the abortion, you see you didn't get anything. There should be fetal tissue there. You suspect that there's an ectopic pregnancy. And nowadays, they routinely do ultrasound. That's how they verify how much they're supposed to charge her for this abortion, because they charge by how far along in the pregnancy she is. You want to make sure that you're getting your full payment for this abortion. So they're doing these pre-abortion ultrasounds. They're supposed to be checking the tissue after the abortion. So in theory, if this is an ectopic pregnancy, they're going to detect it. The woman's going to be aware of it. And this is going to enable her doctors to take prompt, appropriate action. And there are different approaches to that. Some do what's called conservative management, which is where they just monitor the woman for signs that things are going horribly wrong, and they're ready to go in and take emergency action if it ruptures. Because a lot of the time, the embryo will die on its own, and the body will kind of flush it out. So it's not always necessary to go in there, take out the tube, or do something deliberate to kill the embryo. Some doctors are a little more aggressive. They go in right away and deal with it. But the point is, if that woman goes into an abortion clinic, they should be detecting whether this embryo is in her uterus or somewhere else. And they don't. So women who choose abortion are actually more likely to die from a ruptured ectopic pregnancy, even though in theory they should be less likely to die. That tells you pretty much everything you need to know about modern abortion practice. Now, why is this not moving? There we go. Now we're going to go back to Chicago, 1908. So this abortion was performed by a midwife, as most abortions in late 19th century and early 20th century Chicago were. They were almost all doctors or midwives. And the abortion lobby is saying that midwives and nurses and nurse practitioners and physician's assistants should be legally permitted to do abortions, and in some states they are. So the fact that this was a midwife and not a doctor is something that the abortion lobby would not change. They want them all to be done by doctors or midwives, right? So By today's standards, this would have been a safe legal abortion. And I got this from a medical journal article, and they identified the woman as Mrs. G. I don't know her name, of course. She doesn't match up with anything in the Homicide in Chicago Interactive Database. I just give her the pseudonym Sophie. So on September 23rd, 1908, Sophie was admitted to Cook County Hospital. 2 weeks earlier, when she was 10 weeks pregnant, she had gone to a midwife for an abortion. As she began suffering chills, fever, and abdominal pain about 5 days later, after 2 days of those symptoms, a physician did a curettage to try to remove any retained tissue, which is what you would do now. But Sophie was feeling even worse. So over the course of the ensuing week, her condition deteriorated. When she was admitted, she had a tender and distended abdomen. Her pulse was 120, respiration 30, and a fever of 101.4. And she was incoherent. So they found an enlarged uterus, a swollen cervix, and a purulent, which means pussy, vaginal discharge. On September 26, her condition was still bad, so they attempted an additional surgery of dilating her cervix, doing curettage again, and then irrigating the uterus with a sterile solution to flush out any infection, and then packing it with sterile gauze, which is a way of dealing with an internal infection. But Sophie's fever spiked to 108.6, her pulse to 160, and her respirations to 58. She died on September 27th, 19 hours after the surgery. And that's pretty much the course that would be typical for a safe legal abortion that resulted in an infection.